If the experts are right, the medical tourism industry is still in its infancy. Josef Woodman is the CEO of Patients Beyond Borders, a company that helps link patients with treatment centers. He says there's only one way the industry's earnings are heading, and that's higher.
Well, it's compared to the total healthcare industry, it's still tiny, but that's right. Around 9 million people around the world travel for care. Around 800,000, 900,000 Americans leave the U.S. for care. About 800 or 900,000 patients come to the U.S. for care, and for very, very different reasons. There are a lot of different reasons why people travel for care. It's not just one reason.
Your company put out some interesting statistics about healthcare costs. It found that certain procedures are much less expensive in other countries compared with the United States. We have some of these figures now from your website. Brazil, costs are 25 to 40% less. Costa Rica, up to 65% less. India, up to 90% less. And the list goes on and on. It's not shown here, but in a place like Shanghai, it's about 70% cheaper to get a knee or hip replacement. So lower costs, they're certainly attractive, but how can people be sure that the quality of care is the same?
Well, that's a good question. And some 15 years ago, you couldn't be, because there were no internationally accredited hospitals and clinics that differentiated a quality hospital that offered Western care from a clinic you might have had to go and bring your own bandages in order to get care. But the Joint Commission, which a U.S.-based accreditation agency, the largest hospital accreditation agency in the world, about 15 years ago established an international division. And they've had astronomical growth because the quality of care is growing so much. Hospitals want to differentiate themselves. They have now over 600 U.S. accredited hospitals where Americans can go to get almost any kind of procedure you can think of that's appropriate for medical tourism.
The U.S. Health Agency, the Centers for Disease Control and Prevention, or the CDC, has a list of concerns that they've actually come up with. They include issues of communication where language might be a barrier, standards of care like not using fresh needles or reliable medication, even issues like where the blood supply comes from and getting back on a plane after surgery. That, of course, can increase the risk of blood clots. So here's the question. To what degree are people rolling the dice by seeking out medical care on their own? After all, it's not like you can actually go and preview the facilities before you actually get there.
Well, certainly any time you enter a hospital, whether it's in the United States or the UK or Shanghai or Seoul or Singapore, there's a risk. The risk is greatly mitigated when patients do research on the hospital. They want international accreditation. You want to do research on your specialist, on your doctor, whether you're here at home or whether you're traveling for care. And get those doctor's credentials, get the accreditation of the hospital, ask the right questions, and you're going to greatly reduce your risk. Many of the hospitals, by the way, around the world have much lower rates of hospital-induced infections than exist in the United States because they're newer, they have better ventilation, and it's a whole new ballgame because the hospitals are so much newer.
So, Joseph, if someone's watching this and is deciding whether or whether not to travel for medical care, what are some of the key things that they should be thinking about?
Well, we talked about accreditation and certification for doctors. Patients should definitely do their homework and and bring all the paperwork. They should not go in without bringing their homework to the doctor. So medical records, lab tests, consultations, second opinions, x-rays, all of those things, the overseas doctor is going to, that's his or her roadmap for a successful treatment. And by the way, they should bring all of that back after they've had a treatment outside of their home country.
Josef Woodman, thank you so much for your time. Certainly appreciate it.
Thank you.